So again, just a little bit of a background to the question. The four highest cancers, although all cancers are, relatively important when you get that initial diagnosis. But the highest cancers that we have that affects most of the population are breast cancer, lung cancer, colon cancer, and prostate cancer. And interestingly enough, those four high cancers, African Americans are the highest number that are initially diagnosed with those cancers. So the National Cancer Institute states that there are something called social determinants of health that creates a barrier to cancer prevention. Those social determinants of health are areas where there is a high minority population, low income area, low health literacy. Health literacy means that a lot of people, they have really no idea about the disease process, and how to work, what they need to do in order to live healthy lives. There's sometimes long travel distances to screening and treatment sites. Again, the lack of health insurance and the lack of transportation to the medical facility, and also receiving timely cancer screening tests. So a lot of times people they don't know the age of when they're supposed to get tested for certain cancers. What is the risk of them having certain cancers, and when they're supposed to get tested. There's also primary prevention. I believe that primary prevention medicine is really not given as much of the financial resources that is needed in terms of educating our patients and keeping their doctor's appointment, knowing when to get their mammograms, knowing when to get their colonoscopies, knowing about smoking cessation and stopping to smoking and the effects that can have on lung cancers. Those are issues that are not done enough. There's also something that a clinical research participation. A lot of African Americans are very hesitant about participating in clinical research. So there's not much information in regards to how medication affects the disease process in African Americans versus whites and other racially backgrounds. And that comes initially from a mistrust that some Blacks have in regards to clinical trials. I could mention here the Tuskegee syphilis study, where it was a really horrible time in research and testing for African American males. So those are some of the reasons why there might be a barrier. So I think we really need to increase the community outreach programs, getting into the actual neighborhoods where where people live, and meeting them on their sort of stomping ground, on their level. And instead of waiting for them to come to us in the hospital, sometimes when it may be too late, getting out into the community during fairs, during school outreach, in churches, That's why preventative medicine is so very, very important and a personal passion of mine, because I do believe it's so much easier to prevent a disease than to treat it and try to cure it. In terms of teaching a lot of African Americans proper eating habit. A lot of Blacks, we have a high incidence of high blood pressure and diabetes, high incidence of smoking. Those are the three main causes. For want of a better word, I wouldn't say causes, but it sort of ties in to why there is also such a high incidence of certain cancers in the African American community. So talking about proper diet, exercise, proper eating habits are very important. May also being medical professionals should really be an advocate on a lot of local levels in terms of getting involved in the policies, I believe, in government policies to increase social services for people that are less fortunate than us in order to help with the lack of health insurance that a lot of people have that may stop them from seeking help. Advocating for more staffing, keeping hospitals open and functioning in lower socioeconomic environments is also something that we can do as medical professionals, and to be more hands-on and advocate for our patients. Also, I think a lot of African American physicians should also take the lead in this, because sometimes we have these patients that have sort of cultural issues in seeking help. A lot of them, absolute last thing they will do is go to a doctor. It will not be the first choice. It will be the last choice. So having a lot of African American physicians and doctors and nurse practitioners speak to them from their country of origin also helps in letting them know that we understand their concerns, their religious beliefs, but we're here to say that, there is a different route as well. So again, it works back into physician communication and speaking and outreaching to the patients where they're at.